Functional neurological disorder, or F&D, is a common neuropsychiatric condition in which the nervous system functions abnormally in the absence of any known structural neuropathology. Rehabilitation strategies for this population are largely understudied, and with the help of the Richard S. Matterson Education Research Fund of the Foundation for Physical Medicine and Rehabilitation, we want to change that.
My name is Ginger Polich, and I'm part of a team of clinicians at Brigham and Women's Hospital and Spalding Rehabilitation Hospital. Here we treat many patients with motor F&D, which can affect gait, balance, coordination, and strength, using physical therapy and sometimes psychotherapy. In recent years, functional neuroimaging studies have started to show what types of brain activity is underlying F&D, and abnormalities have been found in parts of the brain involved in motor programming, emotional processing, and attention regulation.
My name is Lauren Carter, and I'm a physical therapist at Brigham and Women's Hospital, and one of the things that I specialize in is treating patients with a functional gait disorder. Functional gait disorder is characterized by an abnormal walking pattern that is inconsistent with an organic etiology, such as a stroke, MS, or Parkinson's. While individual presentations do vary, the most common symptoms include ambulating while dragging a functioning weak leg, ambulating with small, slow steps or a swaying gait, demonstrating sudden knee buckling, or walking with a hyperkinetic gait pattern, which is when an individual will demonstrate excessive movements at their trunk or limbs.
Our team at the Brigham is interested in exploring whether music and rhythm, which acts on many of these same networks and has been found to help normalize gait patterns in other neurological conditions, could also be helpful for patients who have F&D.
My name is Caitlin Head, and I am a neurologic music therapist for MedRhythms and Spalding Rehabilitation Hospital. In an inpatient setting, neurologic music therapy works in co-treatment with physical therapy to use music to improve someone's walking. Through neuroimaging, music has been shown to have a widespread activation in our brain, activating not only the auditory cortex, but also motor planning regions. When we as humans passively listen to music with a regular beat, we are able to entrain to that rhythm, priming our motor system for coordinated movements. This intervention is called rhythmic auditory stimulation and harnesses the brain's ability to synchronize movements to improve areas of gait or related to movements. It has been most commonly used for patients with a stroke, traumatic brain injury, Parkinson's, and other neurologic injury or diseases. Up until recent, we had never experienced how the effects could improve someone's walking for individuals who have F&D.
With physical therapy, we seek to optimize a patient's gait mechanics through creating an exercise program that is feasible for a patient to perform on a regular basis, as well as educating them on symptom management strategies to facilitate normalization of their movement patterns. Turn around.
Our team will be conducting a pilot study using rhythmic auditory stimulation for functional gait disorders. We'll assess patients at baseline, after the intervention, and at 3-month follow-up. And this will include a combination of patient self-assessments, standardized physical therapy metrics, as well as kinematic measurements recorded through gait sensors. Our aims in this study are to assess feasibility of this intervention for F&D and also see whether this intervention warrants further inquiry through a larger randomized controlled trial. This pilot study is the first step, and we could not do it without your support. So thank you again, Foundation of PM&R, for making this happen.